The following segment is sponsored by United Healthcare. Health insurance open enrollment is coming up for millions of Americans, and it's more important than ever to have a health plan that's right for you and your family. The Chief Consumer Officer for United Healthcare, Rebecca Madsen, has tips to help families pick the best plan. Hi, Rebecca.
Thank you for having me.
Okay, for those that might not be sure, what is open enrollment?
Open enrollment is the time of year where you pick the health benefits for yourself and your family for the coming year. It's usually about 2 to 3 weeks in the fall if you have an employer-based plan. So usually during October and November. So right around now, we're right in the middle of it. And if you have a Medicare plan, from the middle of October to the beginning of December.
And what are some tips that can help people pick the right plan or even save money on their health care?
So the first thing you mentioned is time. So just invest some time in the process. Don't just check the box. Look for changes in your plan. So often year over year, carriers will change or the specifics of the plan will change. And also what's changed in your own life. We know almost half of people said they looked to change their plan as a result of the pandemic. The second is cost. Not only the premium, that's the amount that comes out of your paycheck, but also the deductible. That's the amount you pay out of pocket before your insurance kicks in. And then coverage. Make sure your providers are in network, your facilities or your hospitals are in network, and the medications that you and your family take, that they're covered on what we call the formulary. We don't want anyone getting a cost surprise, so spend some time and look and make sure that all your providers and your medications are covered.
Okay, good to know. And are there any new healthcare trends due to be aware of that we need to think about?
So one thing we saw during the pandemic that's really accelerated is the use of virtual care. So looking and trying to get a provider 24/7 through your phone, your tablet, or your computer. We saw this accelerate during the pandemic when people couldn't receive in-person care. And we expect that to continue. And not only is it accessible, but it's also affordable. The second trend is wellness, and it's never been more important than now to stay healthy. And about 70% of employers offer wellness programs with an average of $600 in incentives. So you can put money in your own pocket and stay healthy. For example, we have a program called United Healthcare Motion. You can earn up to $1,000 by doing healthy activities such as walking and doing health coaching. And the last trend is specialty benefits, vision and dental. They're often inexpensive and a great way to take care of your whole health. And you can also see things such as cardiovascular health by looking at your oral health, and diabetes by getting an eye exam.
Fantastic. Where can people go for health insurance information?
We have a website, uhcopenenrollment.com. There's helpful information and tips, and we hope it makes this process a little bit easier for people.
Awesome. Thanks, Rebecca. Thanks for all the info. Have a great day.